Hi, my name is Hannah Storm, and welcome to my TED Talk about addiction and dopamine. As some of you may know, many people around the United States struggle with addiction and the effects that it has on their everyday lives. The U.S. Department of Health and Human Services found that more than 20 million people in the U.S. struggle with a substance use disorder, and many people don't get the help that they need. This semester, for my research question, I studied what is the relationship between addiction and dopamine, and what dopamine-related factors impact the severity and persistence of the addiction. To answer the first half of my question, the relationship between addiction and dopamine is complex. And in order to understand it, you need to know the difference between physical and psychological addiction, the impact of stimulant and depressant drugs, how research has set us back, and past treatment implications. Let's start with physical addiction. Physical addictions are defined as a compulsive urge to use addictive substances despite physical health complications and symptoms they may cause, including comas, cancer, and sometimes, in most cases, ultimately death. Psychological addictions are defined as a mental or emotional dependence to a substance or an activity, and its dependence is categorized by intense cravings when facing negative consequences, even when facing negative consequences, such as mental health disorders or loss of friends and family. Now we're going to do an activity. Out of the drugs listed, which drugs do you think are physically addictive, psychologically addictive, or both? Over there, that's an amphetamine, cocaine, meth, bath salts, alcohol, benzodiazepines, and opioids. You guys can answer.
All of them, physically.
Yeah, I don't know what the bath salts is.
I
The
don't
only
know
one
about
that I'm
bath
not
salts,
sure
but I'm
about.
guessing yes.
The answer is that all of these drugs, except for amphetamines, are physically and psychologically addictive. Research from the American Addiction Centers concluded that all substances of misuse are associated with both physical and psychological aspects of dependence. Therefore, this proves my point that all of these drugs are both physically and psychologically addictive. Before researchers knew this, they believed that in the dopamine theory of addiction from the 1950s, which claimed that addiction was only physically shown by addicts and therefore medication was the only way to treat it. This slide is showing that they did not believe that it was psychological, that they didn't believe that addiction was psychological, therefore they believed that addiction was physical. And this led us to the only treatment being medication. But one size doesn't fit all anymore. After abandoning the dopamine theory of addiction in the 1980s, we found that medication is actually a more effective form of treatment for addiction when being paired with a form of therapy. A study done by McClellan and others at Millbank Quarterly revealed that alcohol and medication, that after 6 months, only 9% of participants were retreated for alcohol addiction. This is this top one up here, so that's your 9%. And for medication, when medication was the singular treatment being used, after 6 months, 24% of participants were retreated for an alcohol addiction. For drug addiction, they also have some statistics. For drug addiction with medication and therapy combined, they found that after 6 months, only 8% of participants were retreated for drug addiction. With medication only, after 6 months, 10% of participants were retreated for drug addiction. This demonstrates that doctors and psychologists should analyze all personal brain differences before just prescribing medication. To answer the second half of my research question, what dopamine-related factors impact the severity and persistence of an addiction, I looked at opioids and how they affect natural dopamine production, cause higher rates of addiction, and impact persistence and severity. These are all pictures of opioids. And I found that decreased levels of dopamine, research by the Steve Rumler Hope Network found that opioids are found that opioids are consumed, when opioids are consumed, the amount of dopamine in your brain doubles in comparison to when you eat food. The results are longer lasting, and you get a positive emotional response. Eventually, the brain attempts to compensate for these abnormal dopamine levels by decreasing natural dopamine production. This leads to higher rates of addiction. When dopamine goes down, addiction rates go up. The reason that opioids are highly addictive is because they attack the dopamine reward centers within the brain and the prefrontal cortex and triggers a mass increase and release of endorphins. The opioid addiction, and then this leads us to opioid addiction and severe persistence and severity. So opioid addiction is similar to other chronic relapsing conditions, and signs of opioid usage can be severe, and treatment adherence is often problematic when trying to treat an opioid addiction. My so what for this presentation is I care about this topic because not only many people in the world struggle with opioid addiction, but it's personal to me. My uncle has struggled with opioid usage throughout his life, and I think that treatments would be something that not only he would be looking forward to, but the rest of society would as well. This chart is showing a comparison between relapse rate of substance use disorders and other chronic illnesses. So the relapse of asthma is between 50 and 70%, the relapse of high blood pressure is between 50 and 70%, and substance use disorders are between 40 and 60%. The research from the National Institute of Health revealed that relapse is common across asthma and high blood pressure patients, but it's similar to the rehabs of substance use disorders. Therefore, substance use disorders should be treated like any other chronic illness. Relapse serves as a sign for resumed, modified, or new treatment options. This leads me to what we have currently. What we have currently is 12-step facilitation methods, which are commonly used with AA. It's a structured process or approach that helps addicts address a problem with substance abuse. We're also using CBT. So CBT stands for Cognitive Behavioral Therapy, a psychological form of therapy to break down negative or addictive habits. And finally, the medications that are being used, when I researched this, I could only find medications for opioids and for alcohol. And so the medication that's used for opioids is methadone, and it's naltrexone for alcohol. And then my next move moving forward, so TMS stands for transcranial magnetic stimulation, which currently transcranial magnetic stimulation is to stimulate the prefrontal cortex and the dopamine complex to try and help people process drug addiction and sort of like fix that issue. And right now they're experimenting with it on alcohol and meth addicts, and hopefully it will be an effective treatment in the future. We also something else that we need to do moving forward is stop criminalizing addicts and believing that they're below everybody else and placing a stigma on them based upon, oh, well, you're lower than me because we saw this statistic about relapse rates, and honestly, it's very similar to chronic illnesses. And then I also found a final statistic, and that is that fewer than 1 in 5 people with an opioid use disorder are treated with medication. And so this was a really big red flag for me, not only because it's showing that medication is not affordable, but it's also not within a person's reach, and it's really hard to get a hold of. Thank you. Questions?